Hi, this is a bariatric surgeon's introduction to the GLP group of weight loss medications. And you might ask, well, what does a surgeon really have to say about this? Shouldn't you just kind of be operating? And yeah, it's true that my medical colleagues probably know more about the dosing, the dose escalation, this insurance process with the GLP medicines, and the management of side effects if those should show up. On the other hand, I've had a career focus in weight management since the mid-90s, and so I think I really can offer some useful historical and I hope conceptual context so that we can fit these GLP medicines into an overall strategy for use that's going to benefit patients and going to benefit society the most. As I'm recording this video in 2025, the GLP medicines aren't really new anymore. They've been around since 2015, but they really started having an impact on the practice of weight management in about 2022, and it looks like they're set to continue creating major changes for the next 5 or more years. I think the few years that we've had have given us enough practical experience with the GLP medicines to talk sensibly about how they fit into a strategic plan for managing what I call the metabolic obesity disease. This is the first one of a series of videos that I plan to post on this topic, this strategy. Exactly what medicines are we talking about? Here in 2025, the headlines are about 2 injectable versions of these GLP medicines. The first is semaglutide, which is sold as Ozempic or Wegovy, and the second is tirzepatide, which is sold as Mounjaro or Zepbound. Now, there are multiple next generation medicines in the pipeline that should become available over the next 5 to 7 years. And these next generation medicines are going to have improvements such as better accessibility. And what I mean by that is people are going to be able to take these GLP medicines as a pill instead of the injection. And there are going to be different hormonal effects from different groups of medicines and combination medicines. But I think that I'm not expecting any medicines that are going to be complete game changers that completely change the pharmacologic landscape like the GLP medicines did. And when I say that GLP medicines changed the landscape, what did I mean by that? What I mean is that for the first time, we've had medicines that actually are effective. I mean, weight loss medicines have gone back at least in the 1980s, but previously the benefits weren't worth the effort, the cost, or the side effects. And now there are medicines that lead to real weight loss and real health benefits. Probably just as important, for most people who take these medicines, there can be freedom from food noise, and people can feel like they're in control of their body for the first time in many, many years. Another positive effect of the GLP medicines that I didn't expect when they started to be used is that they are helping society and the medical profession move away from the old debunked idea or paradigm of obesity as a choice, where the patients were blamed for their condition, towards a more accurate and more useful concept of obesity as a disease, the metabolic obesity disease. And now it's not so bad for patients to go into their office and talk to their doctor about their weight. There's less guilt and there's less shame. And thank goodness that's true, because we've been losing the battle against this obesity disease so far. You know, a recent poll showed that 12% of adults had taken a GLP drug and 6% are currently taking one. And maybe that sounds like a lot. I mean, it is a rapidly increasing trend, but did you know that 40% of the US population is currently suffering from this metabolic obesity disease? I would say there is a lot more work to be done. Since this is an introductory video about GLP medicines, let's dip our toe into the science just for a second. The technical name for this class of medicines is glucagon-like peptide-1 GLP-1 receptor agonists. They're analogs, which is a technical term for structural imitations of a naturally occurring hormone. And this naturally occurring hormone has 3 main actions that we know about, perhaps other ones. The first action is that this natural hormone elevates insulin levels, and insulin, as most people know, leads to lower glucose levels, or we could say improved glucose control. This natural hormone also inhibits glucagon, and glucagon is an opposing hormone with insulin. Glucagon increases blood sugar levels, and so this is a different way that GLPs help control blood sugar levels. The third action of this natural hormone and the GLP pharmacology medicines is that there's a direct brain effect leading to less hunger. There may be more that we don't know about. So the natural hormone in the human body lasts only a few minutes, but the GLP medicines that are prescribed and injected that will later be taken as pills last much longer, so they have an extended effect. Now, what I love thinking about with these GLP medicines is we've talked about two benefits. We've talked about how they really are clinically effective in weight loss and health improvement. And we've talked about how they're moving the conversation towards a more sensible approach to this metabolic obesity disease. But now scientifically and conceptually, there's a third benefit where the GLP medicines are showing us some of the root causes or shared causes of some of the metabolic diseases. So we can see that this metabolic obesity disease has shared overlap and shared roots with diabetes and polycystic ovarian syndrome and high blood pressure and lupus and probably many, many other diseases, cardiovascular disease and strokes. So I think that there's a strong benefit of understanding that the weight is probably not the main disease, but the excess weight probably represents the underlying metabolic disease. And so the treatment plans that we implement, lifestyle, meds, surgery, should all focus on getting to the root, the metabolic changes needed to correct this disease. So we're seeing all kinds of hope and enthusiasm around the GLP medicines, and I agree the GLP medicines are an excellent additional tool in our toolbox in this battle against the obesity disease. I just want to bring forward the idea that they aren't one simple solution. In fact, I don't think that there's any single silver bullet solution that's going to give us lasting victory over the obesity disease, even if some marketing makes it seem like there is a single, simple, final solution. If I had one concern about GLP medicines, I worry that for some people, the enthusiasm level will be so great that they may get stuck in GLP treatment when they may actually need to go on to other treatments or go back to foundational treatments such as lifestyle. So what I hope is that patients and their docs are going to insist on putting this awesome pharmacologic tool, or the set of tools, the GLPs, putting it to work as part of an integrated system of obesity disease management. Now, I know that's a mouthful, but basically it means that we ought to have many different treatment options on hand and assess the intensity of disease for each individual patient and match up that patient's intensity of disease with the right intensity of treatment. In my opinion, the option should go from lifestyle treatment, which is healthy food choices, activity, changing the sort of life and food environment. So from those lifestyle levels of intervention up to pharmacology, up to more intense treatment, potentially surgery, again, matching the different treatment plans with that person's particular disease stage. I think the spectrum of options should look a lot like this pyramid, and I want you to take a look at this pyramid with the foundational lifestyle options, the pharmacologic interventions available as a next level, and the surgical interventions available as a next level, probably the minority of patients. Now this is a special pyramid because all the levels interact with each other, and there is a recurring diagnosis and staging so that the patient continues to receive the optimal treatment that's adjusted over time. My advice to those of you suffering from the obesity disease is to get evaluated and get treated. Don't settle for quick fixes because those may end up being fake fixes. I think you'll have the best outcomes if you go beyond your primary doctor to see an obesity specialist, we call them bariatrician, who can help you have access to the full spectrum of tools to treat your obesity disease. Together, you and your specialist can choose the right treatment for you, and you may modify that plan over time. This is not about finding the one magic shot. It's about putting the right plan together so that you can get the lasting health that you deserve.